Now we're going to be going over cranial nerves. One of the best ways to remember this is through a mnemonic that we have. And it's once one takes the anatomy final, very good vacations are happening. I would recommend actually memorizing that and associating them with the various cranial nerves. And then once you get to your test, just writing that on the back of your test. So then you can reference it as you go through the test. As we're learning these, we're actually going to take off parts of their brain so we can get a better view of it. For ease of learning, the model will be flipped upside down like this. But I will be describing the nerves in anatomical position, anterior to posterior, superior to inferior. To begin, we have olfactory nerve 1. That is going to be this guy right here, olfactory nerve 1. It ends in the olfactory bulb here. The olfactory tract is this long section here. The olfactory bulb sits on the cribriform plate and helps us smell. The olfactory tract then connects the sense of smell to our brain. Then we have the optic nerve. This nerve helps with sight. We will also need to know 2 additional terms for this. So this part right here is going to be the optic nerve, which then leads to the optic chiasma. This is the X shown here. And then it leads to the optic tract, which is posterior to the optic chiasma. So it's important to remember that the optic tract is the posterior part of the optic chiasma, and then the anterior part is going to be the optic nerve. Moving on, we have the oculomotor nerve, which is shown here. It's this little tiny guy that is on the front or the superior part of the pons. This is the oculomotor nerve 3. The oculomotor nerve innervates most of the eye muscles, specifically the superior and inferior rectus, the medial rectus, and the inferior oblique. Going directly posterior around the pons here, we are now going to hit the trochlear nerve 4, which is this guy right here. So directly around the pons, trochlear nerve 4. This innervates the superior oblique of the eye muscle. Then we are going to go inferior to the trigeminal nerve 5. That is this guy here. This one is pretty big. It's the largest of the cranial nerves, as it then will split into 3 different branches. So trigeminal nerve 5 here. Then we are going to continue inferiorly and medially, and we're going to hit our abducens nerve 6. That's this guy here. Abducens nerve 6. This innervates the lateral rectus of the eye. If we go laterally, we then hit facial nerve 7. That's this guy right here. This helps with sensing taste and controlling facial muscles. Then we have a bundle of nerves here. This is going to be our vestibulocochlear nerve number 8. Vestibulocochlear nerve number 8. This heads to our inner ear and helps us with sound and where we are in space, so positioning and balance. Then we're going to continue inferiorly to this guy right here. This is the glossopharyngeal nerve 9. And then right next to the glossopharyngeal nerve 9 is going to be our vagus nerve 10. Vagus nerve 10 here. Going down, we then are going to hit our accessory nerve 11. This is going to be at the base of the brainstem. This nerve will access down the neck and innervates the sternocleidomastoid and the trapezius muscles. The last nerve is going to be the hypoglossal nerve 12 here, which can be seen here and innervates the muscles of the tongue. Numbering the nerves from first to last, we have cranial nerve 1, the olfactory nerve, cranial nerve 2, the optic nerve, cranial nerve 3, the oculomotor nerve, cranial nerve 4, the trochlear nerve, cranial nerve 5, the trigeminal nerve. Cranial nerve 6, the abducens nerve. Cranial nerve 7, the facial nerve. Cranial nerve 8, the vestibulocochlear nerve. Cranial nerve 9, right here, the glossopharyngeal nerve. Cranial nerve 10, vagus nerve. Cranial nerve 11, accessory nerve. Cranial nerve 12, the hypoglossal nerve.